Hi, my name is Jennifer Ng, and this is my final presentation for mha616. Sacramento Healthcare is a 200-bed acute care hospital that is run well and successfully increases patient access to state-of-the-art medical treatments and high-quality patient care. Sacramento Healthcare has established a good reputation with the community and is a profitable hospital. However, the organization's IT system is archaic. SHC does not have a chief information officer, which is why SHC's IT system has not been upgraded to include computerized provider order entry, an electronic health record system, or a picture archiving and communication system. While nursing and medical staff have not yet complained about the lack of technological advancements, SHC has not been advancing their IT system while other competing healthcare organizations have. SHC's chief executive officer is concerned that patients and staff will eventually be enticed by these technological conveniences. Investing in SHC's IT system will not only address the CEO's concerns of remaining competitive with rival labs, but also will improve medical staff efficiency and effectiveness. Within the HIPAA security rule, the first HIPAA security administrative safeguard of security management functions requires a covered entity to conduct a risk analysis to properly assess potential risks and susceptibilities of confidentiality, integrity, and availability of personal health information. A healthcare organization can use a qualified third party to perform the risk assessment. There are 5 security components to a security action plan: administrative safeguards, physical safeguards, technical safeguards, organizational standards, and policies and procedures. The first safeguard dictates 9 standards: security management functions, assigned security responsibility, workforce security, information access management, security awareness and training, security incident reporting, contingency plan, evaluation, and business associate contracts with other arrangements. A company's workforce should be trained on and be aware of privacy and security issues. SHC should designate a security officer and security team. This team will be responsible for training each new hire during their new hire orientation and keeping track of all employees' annual training. The second safeguard is physical safeguards. This component dictates 4 standards: facility access controls, workstation use, workstation security, and device and media controls. Essentially, there should be physical barriers to control access to patient data. All hospital entrances should be alarmed and office doors lockable. Computers in the administrative department should all have screen shields to obstruct secondary viewers. It should not be easy for the public to access work computers. Users should always know where their portable devices are and secure them when they are not in use. The third is technical safeguards, and this component dictates 5 standards: access control, audit controls, integrity, person or entity authentication, and transmission security. SHC needs to implement technical policies and procedures that will properly guard access to electronic health records. There should be regular audits of access and network authentication measures to ensure that the people who access electronic PHI are also who they say they are. Organization standards include complying with the HIPAA breach notification rule, which requires healthcare organizations and their associates to notify affected individuals and the Health and Human Services Secretary whenever there is a breach of unsecured PHI. PHI can be secured by encryption, destroying hard copy media, or sanitizing electronic media. Secured PHI cannot be read, reconstructed, or retrieved. Policies and procedures entail composing and enforcing written policies and procedures to ensure HIPAA security compliance. Staff must be trained on these policies and procedures, and their activities can be audited by the security team. Staff can sign an attestation to guarantee that they understand the policies, procedures, and updates. This security action plan should be evaluated each year. Wager, Lee, and Glaser determined the project lifecycle as having 4 essential components: support and evaluation, planning and analysis, design, and implementation. The first component focuses on establishing the organization's IT strategy, identifying faults in the current IT system, and identifying areas for improvement. It is during this first component where an organization may determine that the solution to their problems may not lie in a new system, but in improvements and changes of the current system. The second component involves determining what information staff need in order to perform their job duties effectively. The third component involves the proper evaluation of all potential vendors, a cost-benefit analysis, selection of a vendor and system, and finalized vendor negotiations. The fourth component involves installing and testing the system, and training and preparing staff for system go live, which is when the life cycle starts again. Systems development lifecycle refers to the planning, selection, implementation, and evaluation processes of a new healthcare information system. In the healthcare industry, software is often leased or purchased from a third-party vendor. This is the case with SHC as they want to adopt existing EHR, CPOE, PACS, as well as upgrade the basic departmental IT support that they currently have. SHC's new CIO can use SDLC to ensure that the IT decisions that are being made are consistent with SHC's organizational strategy. In the vendor selection process, SHC should ask vendors to demonstrate their systems. A system demonstration will provide SHC with the first-hand experience of what it is like to operate the system. Important user groups can use this opportunity to provide valuable feedback through usability testing. Usability can be measured via a system usability scale, which is a 10-question survey with each question having 5 possible responses. These questions are designed to evaluate the system's level of complexity, ease of use, feature integration, consistency, and users' desire to use the system. SHC can also use vendor demonstrations and SUS to compare each system's performance to what was advertised, as well as to the performance of other competing systems. This will allow SHC to narrow down which vendor they want to partner with. To prevent staff opposition to change, leadership should communicate the nature of the change and the vision for the company. Employees need to know how a change will affect them and their job duties. Initial communication and subsequent updates about the changes can be communicated through department meetings or company newsletters and emails. In-person meetings are the ideal method for communication because company leaders can easily invite and discuss concerns that employees have regarding the change. If employees understand why a change is happening and how it will affect them, they are more likely to go along with it, even if it may cause them some inconvenience during the transition process. Anytime a major project is being planned, such as adopting a new EHR, a project steering and review committee should be established. The role of a project steering committee is to plan, organize, coordinate, and manage all aspects of the acquisition process. In their project planning process, this committee should also review the existing literature on current EHR products and resources available on the market. This research will ensure an informed decision and aid the selection of the EHR. The healthcare executive team carries out a strategic information system planning process where they identify SHC's strategic goals and how they want to use IT to achieve these goals. The CIO of a healthcare organization can be appointed as a project manager and utilize their communication, organizational, and leadership skills to guide the project. Managers throughout the organization are responsible for properly communicating change initiatives to their staff members. If their staff have questions about these change initiatives, it is the responsibility of managers to address these concerns and get their staff on board. Managers can pass along valuable feedback from end-user staff to the CIO or project leads. It is also the manager's responsibility to make sure that their staff have sufficient resources and training to do their jobs effectively. End-user staff are responsible for implementing change initiatives. If end-user staff are opposed to change and initiatives or do not understand the organizational strategy, this can affect quality improvement metrics because their performance is what is measured. IT governance is concerned with the principles, processes, organizational structure, roles, and committees that an organization creates to make IT decisions. When data is enterprise-wide, it is liquid and it can be accessed through the network. With data liquidity, health data will be maintained regardless of which vendors SHC decides to have a service contract with or if providers merge or are acquired. Enterprise-wide data is essential for maintaining a consistent IT infrastructure. A consistent IT infrastructure will ensure efficient and consistent IT support for end users, even during changes in vendors and access workflows. When an IT staff member or committee is to research or provide IT support, data liquidity allows them to view the system from their office. They do not have to physically go to the site to access or fix an issue. The IT department can also implement IT initiatives from their department to all necessary parts of the system, which saves time and effort. Based on their research and determined needs, the decision-making IT committee can make informed decisions about which IT proposals should be funded to best support an organization's strategic goals. Technology such as an EHR is also essential for making data liquid across a network. For example, if a provider is at a clinic is opposed to adopting an EHR, they will still have paper copies of patient results, and a physician in the main hospital will not be able to view these results without faxing an information request to the clinic. This takes time and can delay patient care, so the physician at the hospital may order duplicate testing instead. Enterprise-wide information allows an organization to integrate and standardize the policies and practices across their system. This is applicable in healthcare organizations that are composed of multiple hospitals or clinics. For example, SHC can have one system that houses all of the policies and procedures for all departments. Any department manager can create and upload a document and have their staff members access and attest to it. Having all staff refer to the same policies and procedures will help standardize care across the system. This will ensure that, regardless of which facility a patient goes to for care, they will receive the same standard of care. A policy is a statement of what an organization aims to do or not to do. Luyirka et al. Describe policies as broad guidelines for decision-making that strategically connect the planning and implementation of any process or planned action. Data governance is the management of data across a system. In healthcare, data governance entails monitoring and enforcing security protocols over PHI. Best practices and policies in data governance entails the data management team to regularly audit patient discharge records for accuracy and completeness. The data management team can work with the IT department to ensure the accuracy and security of these patient files. As discussed in the previous slide, the ability for a provider to access a patient's entire medical record will allow the provider to better assess the patient's complete clinical picture, regardless of where they receive care. Best practices and policies in information exchange entails an open flow of communication between providers and patients so that relative healthcare information is easily accessible. When providers and healthcare entities communicate, all requests for PHI should be encrypted or secured. Patients can communicate with their providers and view their test results via their secured patient portal. Interoperability between health information systems is essential for integrating healthcare delivery at reduced costs. Interoperability is more than just an EHR and can include any electronic source that supplies information that can be used to provide the highest quality patient care. This can include home health monitoring systems, telehealth, and public health databases.